friends. Welcome back to another Movement is Medicine show.
It's been a while. I know. I'm excited to get back and talk about, well, my favorite topic.
Yes. Soft tissue, reset, mobilization, injury, everything soft tissue related.
Really, it's such a foundational piece, and it's so misunderstood, under-researched, overlooked by many, many clinicians, doctors. Head to toe, we're passionate about soft tissue injury because we recognize it's foundational, right? It's such a huge piece. And so I wanted to talk about that again today, just so people really understand, hey, what is it? How do I know if I have a soft tissue injury? What do I do? Where do I go? How does it show up in my life? It's really, people don't understand it. And it's because it's sort of just this silent thing that's going on in our bodies every time we train, move, walk, whatever we're doing. It's an underlying thing that's happening. So a silent killer. No, I'm just kidding. That's way too dramatic.
I feel like it is one of those things that it's with your body, you tend not to think about what's happening with your various tissues and ligaments and tendons as it relates to their function unless they're hurting or hurt. So one of the things I think that's interesting with soft tissue is we tend to not think about our soft tissue, where it's at, its state, its readiness for movement, its susceptibility to injury until we're injured.
Exactly.
And oftentimes that's when, it's a little bit too late. We're too late to the party. Now we're doing a lot of work to kind of get out of pain and then restore function. And today we want to spend a little bit of time talking about what we should be looking for on the way to injury, things that we can be doing to prevent that, things to be aware of, different strategy and tactics that you can deploy so that you are injured less often because you're a little bit more aware of what's going on.
Yeah, and it's really tricky because pain, our body's really, really smart, but pain is really the last trigger we get, right? And when we're in pain, it's advanced into a stage where you've got to go in now and you've got to get a treatment plan. You're going to spend some time at it. You're injured, right? And that's when the pain comes in. You've got an active inflammatory process going on, either in a tendon, ligament, something going on in your spine, whatever it may be. But I think it's important, too, to think a little bit about, when we're talking about this, like, what is pain, right? People are familiar with, like, what a stretch feels like if you're stretching, right? And that you can feel something, but that's not pain. But what pain is if you have something that's lingering, right? Say you get a workout in and you got a little twinge in your hip afterwards, and it kind of lasts for a couple hours, and then maybe it goes away. But then you work out again, and there it is again, right? Same place. Same place is a big trigger. If you're getting something hurting in the same area, or you find that, hey, you're squatting and you're really not squatting very level, you can't get down very far, your hips going one side or the other, your knees poking out, whatever's going on. You see something that's not right with your form, doesn't feel right. Anything like that that's lingering, or anything that's stabbing and sharp, or just kind of wakes you up, that's an injury.
Perfect example. Thanksgiving, I did a turkey trot, 4 or 5 miles or so. Felt great. I loved it. It was a blast. 3 days later, I did a CrossFit hero workout called Laredo, which was a lot of hips, like a lot of squatting, some lunging, and then again, a bunch of running at intensity.
Yeah.
Then yesterday, I ran on the treadmill, and it was like 2 giant needles were being stabbed through my glutes and hips, like over every time I ran. Did I stop running? Of course not. I ran again for 30 minutes. And this morning, I could barely walk up the stairs. It was stabbing pain in my hips and my back glute muscles. Mm-hmm. So I stacked a series of workouts together that I was maybe a little underprepared for, or I didn't warm up, or I didn't cool down, or I didn't stretch. I did literally nothing in between those workouts. Didn't foam roll, didn't lacrosse ball. And that all culminated to then when I did that 30-minute treadmill workout, which should have been no big deal, now I'm in a state of pain. I can't do a low body workout today.
Yeah. As the great Stuart McGill, one of my idol doctors, says, there's a really fine line between building and breaking. And you broke. Sorry, Barry.
Yes, I did.
But there really, really is. And I did the same to myself this weekend, right? I skied 3 days in a row, and I went to do squats this morning, and I'm like, oh, that hurts. Right? I wasn't aware of it until I got into a movement.
Well, this is what we're talking about. So this self-awareness around your soft tissue and where your body's at, oftentimes, for people who, it doesn't matter your experience level, or even if you are professionally dialed into this, it just creeps up on you, and all of a sudden you're in a state of pain.
Right. So what do we do about this? And so obviously there's the rest piece. But the soft tissue mobility work, that's your reset, right? That's how you lower the injury threshold. Because you think about building muscle, whether you're a recreational athlete or weekend warrior, whatever you do, you're building up, you're breaking, you're building, you're breaking, you're building. But there's, again, that point where it breaks too much, right? And then you're getting into a stage where your soft tissues, you have to remember that muscles are these beautifully oriented little spindles of fiber, right? They're all layered the same way. They've got fascia around them. They've got nerve, blood supply. We have gazillions of muscle spindles making up our beautiful muscles. But when we get too much breakdown, the soft tissue heals with this tangled up like ball of yarn type of thing, right? It's this big knot. You feel the knots in your legs. It no longer has that nice tensile length to it. It doesn't contract or relax like it should. It doesn't have the blood supply it should. The nerve gets a little squished. It's not happy anymore. It's not firing like it should, right? So that's what's happening underlying with a soft tissue injury. We're getting this continual breakdown, rebuild, breakdown, rebuild. But unless we take time to trigger point our muscles with a lacrosse ball or a foam roller or some instrument like that, and really release those trigger points, those myofascial bundles, and then work to reorient the fibers so they're long and your muscles long and supple again, you are going to get a soft tissue injury. So if you think about anatomy briefly, you take that muscle that's all tangled up and shortened, right, like described, and it's attached to a tendon, which is attached to a bone. The tendon's getting pulled on mercilessly because this muscle's short and tight. The tendon starts to react by getting thicker. This is what we refer to as a tendinosis, right? So it gets thicker, it gets pulled on. Eventually, it inflames. We get an itis, a tendonitis, and that's when we get pain, right? That's when the pain really starts to signal in. Or you get an inflammatory process in your joints. But that's the process that's building up all the time. And so you may not be aware of it. It may not be hurting, but you really need to get down and do your soft tissue work really every day. If you are working out and training, you should be using a lacrosse ball daily to lengthen out your structures. It's really imperative. So what we've done here is we've built a nice handout for lacrosse ball that will be available in this video or podcast.
Podcast
both.
and video.
It'll be a free download for you to grab. And it's a little brief on lacrosse ball work, on just resetting those muscles. Really simple.
Because you need some structure and you just need a little bit of direction. Because oftentimes it's like, oh yeah, I know I should be doing that mobilization work. But unless you have a person who's told you do exactly this for exactly this long, and oh, by the way, it's about 5-6 minutes, and that's going to cover a lot of your bases. And here's the exact 3, 4, 5, 6 things I want you to do with the lacrosse ball. It's like anything, you show up at the gym. If you don't have a workout plan, you can kind of just wander around from machine to machine. Mobility work is the same way. You really want a little bit of structure. And so this lacrosse ball thing that we put together here for you, think of it as a little workshop, think of it as a mini flow, a little workflow that you can do on the daily. That's really what it's designed to do. Like grab your phone, hit play, follow along with the video. And when you're done 5-6 minutes later, you're going to be in a much better spot. Now, is that pre or post? Is there a better time to do it? Let's talk a little bit about mobilization.
Yeah, absolutely. That's great. I think I really like to do a little lacrosse ball work before I work out. That's the best. Stretching is, we've talked about stretching before, but stretching is, it's not that it's bad, but it really makes you a slower athlete, right? Especially a long hole stretch. So it's not the best thing to do before you work out, but using a lacrosse ball or a foam roller to release those trigger points is awesome. It just releases your fascia and your muscles and your tendons, and you're able to then work out really strong. That's the best time to do it before you work out. I also like, if you're not working out or training, it's really great to do it before bed, actually, in the evening to do your lacrosse ball work. And it's not hard. You don't have to do every single body part, but you need to find the spot that's sore, and that's where you focus on. So it's really a short process, really easy.
Don't overcomplicate it. This isn't like a 20-minute thing. This isn't signing up for a yoga class.
Easy. And it'll help to prevent that soft tissue injury from building up. And when soft tissue injuries go, they take a while to heal, right?
They do. Like when you've tripped over and you're actually hurt, that process is quite a bit longer to get back to a state of your functional foundation.
Yeah. Essentially, it takes longer to heal a soft tissue injury that's turned into a tendonitis than it does a broken bone, right? It takes a while. You've got to rebuild all that tissue, and then you've got to refire all that muscle to get it working. You're going to keep moving, but you're going to compensate in ways that are not sustainable for training. It's going to lead to further injury.
Interesting. When you think about, so here we've kind of outlined the basics or an approach you can use for at-home self-care. which is critical component of both injury prevention, but then if you are in an active state of hurt, pain, injury, along with a clinical treatment plan, like you'd find if you come in to see us, this is something that's going to help. But talk to me a little bit about coming into the clinic as part of that ongoing preventative maintenance or like preventative care, where you start to get some of those tweaks and twinges. So you might have that beginning of the stiffness, or you might have a twinge here or there. And that's oftentimes when we could be doing a lot of great work with therapy in the clinic.
Yeah. I mean, okay, so end of the year, all you folks with amazing insurance benefits and you got a whole bunch left off and you just feel like, hey, maybe I will get that little tweaky feeling I get checked. We can see so much with just a mobility screen, right? We can see it in your gait. I can see it in how you walk into the treatment room. I can see it how you sit in the chair. Like all of us watching you move, which we are the moment you walk in, we're going to spot your dysfunctions. And of course, we have a more formal process as well, where we take you through movement, look at your gait, all that stuff. But that's where we're going to see the beginning of that dysfunction from a soft tissue injury that's forming, but not yet fully come to the surface. That's when you want to be treated.
Well, and I think a lot of times people, when they think about end of the year, new year, a lot of times they're thinking, well, when the new year comes, 2025 or whatever the year is, that's when I'm going to go crazy. I'm going to kick my activity up. I'm going to get my gym on, my fitness on. But the thing is, and I've seen this so many times, then people jump into it and they're carrying some prior conditions. They have some soft tissue issues because basically, like if you're a human being and you're alive and you're probably like over the age of 10, most likely you have like soft tissue issues.
Exactly.
I mean, you don't think teenagers have soft tissue issues? Almost every teenager I know has soft tissue issues, especially in their back, neck, depending if they're playing sports, they're going to have that same like wear and tear that we do. And I think that January is going to come, I'm going to go hit it in the gym. And then 2-3 weeks into it, something breaks. And it just also syncs up with like end of the year benefits, which is super cool. We should be thinking strategically, I'm going to get these aches and pains and these little issues. I'm going to get some prehab. I'm going to come in and get my movement assessment done and get some sessions in so that I am ready to go when we switch over and launch my new fitness thing I'm going to do.
So much more successful. I mean, prehab is the word. You just nailed it, because we have to get these things moving, especially if you've been out of the fitness game or maybe just walking or just doing like light workouts every now and then, but you're ready to achieve some different goals in 2025. Get it functioning well, smoothly, get your mobility back. Let's get your body repatterned is a word. I know it's kind of complex to think about, but when you think about us as completely neurological, we have to get everything rewired so the muscles are functioning well to support your structure as you move. And that will lead you into a successful start to your fitness journey, right? Everyone goes gym crazy in January, and I love that. But let's make it successful and sustainable. Because if you're my age and you're like, yeah, I'm going to hit it like I did when I was in my 20s, and you haven't trained in a while, and you haven't been looked at or checked over from a bodywork perspective, then I hate to say it, but the wheels are going to come off the bus.
It becomes very easy to injure yourself as you get into your 40s and 50s.
Does.
Unfortunately, very easy.
It does
to injure yourself. And this is where we have to take it more seriously. So both in terms of our self-care at home, which again, we'll have a free resource. So whether you're watching this on YouTube, the link will be in the description, or on the podcast, will be in the show notes. This is something that we want you to download, sign up for, get in. It's a free resource. It'll guide you through the process. And then also, in addition to that, if you're local here in the Edmonds area, Linwood area, greater Seattle area, north of Seattle, come in and see us. We have 3 weeks left here in the month. And a lot of times, if you're sitting on insurance benefits, these are a great time to use some of those. I know personally, that's what I'm going to be doing over the next couple of weeks. I'm sitting on some insurance benefits, and that hip issue I talked about earlier, I have already booked myself to come in and get some work done because I want to hit it hard in January. It's a big push for me. I've been on a physical push, and I don't want to lose momentum, and I don't want to get injured because everyone, all of us have been in that spot where we've been pushing hard. We've felt that momentum. We get really excited, and then we get hurt. And it's just so demotivating, and it just derails you so much. It's so frustrating. Well, it doesn't have to be like that. Get that work done prior to the injury happening.
Yeah. And if you're in a gym or working with a personal trainer, they'll be able to see a lot of this going on with you too. They'll watch if you have a consistent snag in some of your movement patterns. Generally, that's something going on in there that's just, it's not mobilized correctly. The tissues need some work. So, turn to resources like that as well to sort of figure out if you've got something going on underlying, because I'd love to see that get cared for before it becomes an injury. 20 years of soft tissue injuries, so I see a lot of it.
Yeah, you see this kind of cycle happen.
Yeah, I really do. And it's really misunderstood because when you go into PCP, ortho's looking, do they need to cut it? Do they need to repair it? They're not looking at a soft tissue injury cycle, right? That's not what they're doing. And PCPs, they're going to say, hey, let's do a muscle relaxant. Let's do a, anti-inflammatory cycle. And anti-inflammatories, by the way, they'll take the pain down and put you back into training, but you are not going to have the movement that you should have. You are not going to be able to train authentically. You're not going to be able to train to your full strength. So it's a cover-up mask, and it actually puts you in a dangerous position for a bigger injury. And so there's just not the resources, but a skilled person with their hands, with their eyes, with the movement screen can really help you determine if you've got something underlying or not. And then just your own awareness. Like, I've got this thing that keeps cropping up. That's what you need to think about.
Yeah, honor yourself, honor your intuition, honor that feeling, honor that tweak, honor that twinge, especially as you progress past the age of 28.
We left it for 15 or 10.
Exactly. You can still be a little bit cavalier in your 20s and you'll probably be okay, but it maybe not. But I'm telling you, those tweaks and twinges can really knock you out of the game for a while as you progress. So if you're hearing this and that resonates, jump online, book. There's spots do fill up at the end of the year. The clinic is really busy. So please take action now, book out a series of treatments. I always recommend, if you have some of these tweaks and twinges, don't think I'm going to go in one time between now and the end of the year and I'm going to be great. Think I'm going to try and get 4 or 6 appointments, whatever it is that you have. But I would book multiple appointments. I really like the cadence of twice a week and even 3 times a week if you're working through a series of things, or if there's multiple body parts or systems involved. Like if you have an upper back thing going on and a neck thing, and you got some kind of a hip thing going on, and you have some plantar fasciitis thing, calf thing.
Well, then we'll see you in 2025 as well.
Yeah, so you got some work to do, my friend. But good news, we'll get the help. But the idea is don't just think one and done. Be thinking book a couple appointments, just book the appointments.
But also for those who are chiro scared, we're not going to be seeing you for 60 visits. Don't worry. We want you for a few if you've really got an injury going on, but then we'll teach you the resources you need to care for your own body. That's what we're about.
And maybe you start with the self-care stuff and then use from there.
Yeah, and if it doesn't do it, then you need more help, right?
Yeah, exactly. Because a lacrosse ball and a foam roller
can work a lot of magic.
Well, thanks for being here. This was an awesome show. Expect lots of cool stuff coming in 2025. So for all of our avid listeners who have been dying for a new update episode and for things going on, we got you covered. 2025 is going to be chock full of incredible stuff. We have great content dropping for you, and we're looking forward to help make sure that you remember that movement is the best medicine. Catch you on the next show.